Let's now focus on the United States, and COVID cases are rising in all 50 U.S. states as the Delta variant is spreading coast to coast, and with less than half the U.S. population fully vaccinated, public health chiefs are warning of an extraordinary surge. Dr. Anthony Fauci, the U.S.'s top infectious disease expert, has warned that more pain and suffering is on the horizon in the U.S. as COVID cases are climbing again, and officials are pleading with unvaccinated Americans to get their shots. Most new infections in the U.S. continue to be among the unvaccinated. Well, to talk more about this, we're joined by Dr. Fahim Yunus, Chief of Infectious Diseases, University of Maryland. Thank you so much, Doctor, for joining us on the program again. Now, it doesn't seem that the U.S. is going to have that summer of joy that President Biden had hoped for. In fact, cases are rising, with the highest number of cases being reported since January.
Right, but I think increasing cases may not be the best metric for us anymore, because what we need to be focusing on is the hospitalizations and deaths. And in US, we are largely seeing two different pandemics, one within the vaccinated and one within the unvaccinated. Typically, 97 to 98% of all hospitalizations in America right now are in the unvaccinated. In my state, Maryland, over 6 million people live here. And during the month of June, we did not have a single COVID death among the vaccinated people. So 99.2% of all the deaths are occurring in the unvaccinated people. So unfortunately, what we are seeing is not a bad disease, but bad choices.
And Doctor, tell us about businesses asking for proof of vaccination and announcement that federal employees are being asked to vaccinate or undergo regular testing. These measures are controversial, there aren't they, but much needed?
Of course, I mean, we cherish the individual freedoms in the American society, and our culture is not very open to ideas that force or push or mandate people in a certain direction. However, we have mandated seat belts in this country, and everybody wears a seat belt, whether you like it or not. We do not allow smoking in our buildings because we've found that to be a public health issue. And I think sooner or later, people will understand that this is not a political issue. This is a public health issue. It's going to start from healthcare industry, but I cannot imagine any industry that will be immune to it. Most colleges, universities are now going to mandate the vaccine. The banks will mandate the vaccine. Disney and Walmart have mandated the vaccine. And I think one thing that will speed it up, make it more palatable, is the formal FDA approval, which we believe will be coming in hopefully weeks and not months.
And what do we now know about the Delta variant? Because that is being seen as the cause of this surge in cases. The CDC, in fact, recently said it's as infectious as chickenpox.
I think that's sensationalism and dramatization. What we truly need to focus on, what's different. Yes, Delta variant is more contagious, no question about it. Delta variant in some studies has caused more hospitalizations, but it's not universal. And we still don't know whether it's more lethal. Probably not. It's not causing more disease in children as some people would like to sensationalize. What can you do about it? I think that's the discussion. One, you should vaccinate. Once again, in a country like America, again, in the state of Missouri, there are more than 6 million people living there. They just had a vaccine clinic and no one showed up there, while estimates show that about 2 million people are still unvaccinated in Missouri. So to me, the discussion of focus on Delta variant is irrelevant when you have 2 million people who are willingly not doing something that is shown to protect against the variant. So I really think this whole focus on the variant is sort of unfounded. The focus should be on vaccination.
And what have the observations been in terms of the breakthrough infections? That's when people who've been fully vaccinated get the infection.
Sure. So the breakthrough of infection is likely going to be 100 in 100,000, something like that. But I think the way I look at that, once again, to me is irrelevant, because guess what? Most of us haven't had a cold or a flu in 2 years now. And if that's what Delta variant or COVID ends up becoming, that it gives me a cough and a cold for a week, once a year, I think we have won. I really don't look at those breakthrough infections as failures. I think to me, that's exactly how we are going to come out of this pandemic, where COVID will become irrelevant. It will be just another cough and cold that people will recover in a week. And that's what most of those breakthrough infections are. Once again, people can make the choice of whether that breakthrough infections ends up putting them in a ventilator or killing them, or them getting better in a week. That's what the vaccines can do for you.
And currently in the United States, are you, seeing that it's vaccinated people also who are spreading the disease, given that people are, mingling quite freely now, and there's been a lot of confusion about the mask mandate?
So I think it's an evolving area of science. We all know that vaccines will reduce transmission. It's just simply logical. You don't even have to look at a study. A vaccine is going to prevent disease, prevent hospitalization. Of course, it's going to reduce transmission. We just had CDC come out, this MMWR that has come out from Massachusetts, where in 4th of July celebrations, some people have given the evidence that perhaps they were carrying as much virus in their throat and respiratory secretions while vaccinated compared to unvaccinated. I think more research needs to be done there. It's a very unusual sort of situation where people came from different states, came for a festivity. I don't think that's how normal life is. So I would wait and hold my judgment, because I think that's an evolving area. For now, people should know that vaccines will reduce transmission, in my opinion, and what the current data is. One study is not going to simply destroy all the previous evidence. I understand Delta may be a new variant here, but we should still hold our judgment and let science play out a little bit more.
All right. Thank you so much, Doctor, for joining us on the program again. Thank you.